dosha. Pitta also plays a major role as it is the elemental of Agni Mahabhuta, presented in the body which governs digestion and metabolism. The quality wise of Pitta is sasneha, slightly oily it is. Tikshna, sharp. That's the reason it helps with the digestion or metabolism, what we call into. Ushna, it's a hot. Lagu, but it's light because it has to help in the fire to move upward movement or any directions to move. It cannot be a heavy. Visram, it has a bad smell. Saram, it's a movable. It has to digest the food particle. That's why it is in the condition of a movable situation. Dravam, it has to be liquid. It has to go and mingle with the food or ahara, whatever we use into digestion. These are the main gunas which we have to remember. Wherever there is a blockages of the pitta dosha, these are the qualities of dravyas. We have to use it, or the foods which have these qualities can be used. If pitta is little less aspect, there we can use some tikshna, which is again ushna also, like our pippali or maricha. Few other products we can use it. And karma of these pitta doshas are pakti, it helps in digestion. Dehoshma, it regulates body temperature. That's the reason we see in a pitta age the temperature will be warm. Darshana, sense of vision, pitta has to be activated here. Shuddha, hunger. If there is no hunger, we do give the products or a medicines to increase the kshuddha, that is hunger. Trishna, thirst. Because of the Ushna guna, the thirst, the water would have been tried out. That's the reason a person feels Trishna. Ruchi is a taste creator. Prabha, virtue. Wah, we say some person whenever we visualize. What a prabha. ಏನ್ ಚೆನ್ನಾಗಿದ್ದಾರೆ ಎಷ್ಟು ಪ್ರಭೆ ಇದೆ. This is what we see use in Kannada. It's a virtue, the glow, what we can see. Meda, intellect. That is the age exactly we can study and learn and inherit in our quality. It's a mid-age of our lifespan. Dihi, determination. Because of its sharpness, it's a hard and it's a mobile and sharp activity. We can determine the actions, decide how to do, what to do. Shaurya, it works courageous also. Tanumardava, but the person will be very delicate because it has a light and sharp. We again have in our pitta dosha, it can be taken as all pervading based on its specific activities. Again, it is well demarked in areas in the body. We have 5 types of pitta. One is pachaka, second ranjaka, third sadhaka, fourth is alochaka, and fifth is rajaka. Its location we can see as a pachaka in pakvamashaya madhyagata, that is in between gastrium and large intestine, which helps in digestion. So, same way in a ranjaka is amasha and ekrat. Ranjaka is nothing but a coloring agent. That's the reason you can see it in amasya, gastrium, and ekrat in the liver. Sadhaka pitta, it is in hrudaya. Alochaka is in eyes, rajaka in tvach or skin. The actions, if you check into the pachaka, which is in between gastrium and large intestine, is pachatanam. It helps in digestion. Vibhajata sakrito separates nutrient and waste from the food ingested. Being the same location, manages the other divisions of pitta also. Ranjaka, as it gives a color agent, amashya, gastrium, and ekrat liver. Rasaranjanam, conversion of rasa dhatu into rakka dhatu. That's why we say it's a coloring agent. Sadhaka, which is in hrudaya, which is buddhi, discretion, meda, intellect, abhimana, self-esteem, and other mental faculties we can see here. Alochaka is which stays in netras, eyes. Rupalochana, perception of vision. is very much important, which Alachaka gives. Brajaka, which is in Tvak, that is skin, it helps in absorption of topical medicaments also. These are the five pittas which have to be kept into the treatment aspects. If at all you are treating anything concerning the tvacha, skin, absorption, Brajaka will be activated. If pitta is vitiated, which causes pitta wet, yellow colored feces, as I told you, THC stays in liver. Pitta mutra, yellow colored urine. Pitta netra, yellow colored eyes. Pitta tvak, yellow colored skin. Atikshutha, raised appetite. Atik trishna, raised thirst. Daha, burning or fever like feeling will be there. Alpanidrata, when all the fire actions. Tikshnata is there, heart is elevated, you cannot sleep, so it causes you reduced sleep. Then comes our third dosha, which is kapha dosha. Kapha dosha is the elemental of Ap and Prithvi Mahabhuta, exhibiting favorable and unfavorable activities as per its state of balance or otherwise. Kapha dosha is the basic requirement for the formation of the physical body and is responsible for keeping intact the tissues in the body. Guna and karma of kapha dosha. Guna wise, it is snigdha, it's unctuous, it binds. Shita, it's cold. Guru, it's heavy. Manda, it's dull because of its heaviness. Slakshana, it's a smooth. Mrustana, it's a shiny. Sthira, it's a stable. Because it's heavy and dull and unctuous, it has to be stable. The karma wise sthiratva, stability, snigdatva, oiliness because of his unctuousness. Sandhi bandha, it binds well formed intact joints because of its unctuous, its smoothness, its stability formation. Vyadhi kshamatva, it causes, it builds up a strong immunity in our body. Kshamatva, endurance, it creates into our system. These are the kapha doshas, guna and karma. If kapha is vitiated, agnisada, because it's heavy, it's a dull, it's a manda, what we told about the quality of it. It's a guru also, what we explained about it. That's why it causes indigestion. Praseka, it causes water burst. Alasya, laziness because of his gurutva. Gauravam, heaviness. Shvayadha, pallor. Shaitya, cold and calming, it creates because of its shita and snigdha quality. Shathangata, worn out feeling. Shvasa, dyspnea. Kasa, cough. Atinidrata, increased sleep also we can see because of its heaviness quality. Snigdhata also is there. Shita quality is there. It's guru and it's manda. So it has to increase the sleep in a person, whatever we check into. So these are the qualities which has to be kept in mind for our treatment aspects, which will help in future treatment concerns. Even in kapha, it's a pervading based on its specific activities in well-demarked area of the body. It is divided into 5 divisions. One is avalambaka kapha, which is in uras, that is chest, and trika, sacrum. Its actions will be complete fluid balance it does, supporting other divisions of kapha. Avalambaka. Kledaka, which is in amashya, gastrium. It has the food, whatever we eat, has to be moistened, emulsified because of the churning habit, whatever it has to take part. Movement, mobility, then the food exactly has to move from one part to the other part. That is in amashya. For that, kledaka kapha is very important. Bodhaka, rasana, is in tongue. Perceiving the taste. what the taste food I am eating, whether it is Madura or Amla or Lavana. For this differentiation and appreciation, Bodhaka Kapha is very much necessary. Tarpaka, which is Shiras, head. Akshatarpana, replenishing the sensory organs that completely manages brain aspect. Cooling, memory, whatever you want exactly with the brain activity, this can be taken care of. Shleshaka, which is in a sandhi, joints. That's why we say synovial fluid. It has to be there because it has to lubricate in the sandhis. Otherwise, joints become dry. You can hear katakata sound, grips, what we call in a medical science. But in our Sanskrit, in our Ayurveda, katakatayana, we say. The sound itself tells us katakata it makes. That is joints. It's a worn out joints. Shlesha kapha is less there. Vata would have been increased there. That's why the sound comes into here for the pictures. Okay, we have gone through with Vata, Pitta, and Kapha. In the body, generalized where all we can see, it can be demarcated. Name of the doshas with Panchabhaudika position also we have to check in and location in the body. Just we'll glance about it. Vata is a Vayu and Akasha Mahabhuta it is made up of. Whereas location wise, it's in Pakshavaya, large intestine, Pakvashaya, large intestines, Kati, waist, Sakti, thighs, Sparshendriya, Vata, wherever is done with light. Blue color. So we can see it in intestines, Kati also, and Shakti thighs, and Sparshendra Tvak. Pitta, Agni Mahabhuta. In Pitta, only Agni will be there. No other Mahabhutas are majorly present. Nabhi, navel region, Amashaya, gastrium, Sveda, sweat, Lasika, lymph, Rudiram, blood, Rasaha, chyle, whatever the food what we eat after churning in the mouth with our Lala Rasa, that is Italian, whatever the juices are present in the mouth. When it is mixed with the food, it is known as a chyle. Drik, eyes, Sparshana, skin. Kapha dosha is made up of Aap Mahabhuta and Prithvi. That's why it is heavy and it's a movable also and cold. Kapha. Uraha, chest. Kantha, throat. Shira, head. Kloma, omentum. Parvani, small joints. Amashaya, gastrium. Rasadhatu, rasa, medo dhatu, adipose tissue. Grahana, nose and jiva, tongue. You can see in all these presence of our doshas. These demarcations help us to act how it can check in. This is a natural variation of doshas are shown in the following table. On a day, whichever dosha is predominant, which dosha is in a resting state, we can check in. So from morning 6 to evening 6, if it's check in, from sunrise to sunset, we can see Kapha, Pitta, Vata. Again from sunset to sunrise next day, Kapha, Pitta, Vata. Morning, early morning from 6 a.m. to 10 a.m., we can see Kapha dosha. Good to have good food. So we say we can have a good food like a king, which can be digested and rectified. Whereas 10 to 2 is a Pitta Kala, where sun also is raised in Anda and Pindanda also. 10 to 2 is a Pitta Kala. Whatever the breakfast we have taken, heavy breakfast, that can be digested, assimilated into our body. Then comes our Vata Kala, that is 2 p.m. to 6 p.m. sunset, before sunset. Say into here we can start seeing all the sunrise comes down, night, evening wind starts, later part. That's why morning, sunset, sunrise, and before sunset, we advise to have a food. Later period, give a rest. So, in a day, twice food was advised. In the night time, 6 p.m. to 10 p.m., I think earlier days there was no electricity or something. People used to sleep before 7 or 8 because there was no sun light for them. So they used to sleep and rest from 10 to 6 a.m. or 10 to 4:30 before the sunrise. Brahmi Muhurta. Whereas if you check in 10 p.m. to 2 p.m., you had to have a sound sleep. Pitta action would have taken. There's a time where our liver and gallbladder start acting even according to other sciences also. There's a time you have to rest, otherwise whole day will be difficult for the person to move around. This all has to be considered in easier, better way of our life. If you check into the age wise, Vata phase of life will be there, which period means it will be there in the old age, what we can say. This is the way we differ according to Siddha people. They say Kapha period comes last lead part, whereas we say Vata is that. In Pitta is a youth age, Kapha is a childhood. That's the reason we say, according to Ayurveda, in the childhood we can see a lot of upper respiratory infections like a cold, cough frequently. In Vata, because of the dryness and everything, the joint aches, joint pains, body pain, all we can see in the old age. This is the how Ayurveda stands for. Aha day, that is in a midday, afternoon day. If you check in Kapha, initially it is 6 to 10 a.m., middle 10 a.m. to 2 p.m., then Vata is 2 to 6 p.m., what we saw in the picturization mode. Ratri night exactly, Kapha will be predominant in 6 p.m. to 10 p.m., then Pitta 10 p.m. to 2 a.m., and Vata 2 to 6 a.m. Bhakta process of digestion. Kapha initial part of digestion takes place, whereas in Pitta middle part of digestion will be there. In Vata last part of digestion takes place. These are the phenomena to be followed for our health aspects to be maintained and contained. Vata, Pitta, Kapha has to be balanced in a better way for the disease to be maintained or the health to be regimen to be maintained. If anything goes in excess, it causes a problem for. Anything goes less also causes problem. Maintaining in Madhyama is the best lifestyle. So we will be covering later part how Saptadhatus will be working, where our organs, malas, all this aspect comes. But Ayurveda stands mainly on Tridosha Siddhanta, Vata, Pitta, Kapha. But we can't see any person single with Vata or single with the Pitta or single with the Kapha person. It's a combination of the doshas, Vata, Pitta or Vata, Kapha, and Pitta, Kapha or Pitta, Vata. But other dosha also will be in a mild status wise. But the age wise, which will differ. The prakriti wise, will differ. So when we consider a person here, Vata, if it is a predominant one, what is the actions? Pitta, predominant and Kapha. Rest of the balances will be there. So we have to have a completely knowledge of Vata, Pitta, Kapha doshas for a person to be treated. Thank you for today. All this aspect you have to brush up, and see you people in the next session. Thank you.